I'm in that group because of a terrible family history of breast cancer that it's recommended for me and my sister to do the alternating mammograms and breast MRIs. The last breast MRI I had, I ended up having to pay like hundreds of dollars because insurance covered part of it, but not all of it. And what are the solutions? Is that something that should be handled at the state level or the federal level? Because not everybody would be able to afford that kind of copay.
Yeah, so at the state level, there's been repeated attempts to try to expand the coverage, but the state has some limited jurisdiction and opportunities there. But we know that catching cancer early saves lives, it reduces costs, and so it's a benefit to all. And it lowers costs for healthcare. So I think it's really important at a federal level we look at making sure that those screenings are covered, because anyone that has dense breast tissue, you're not going to pick it up on your annual mammogram. You need a closer look.
You've talked about this issue as the state legislature. What sort of things, if you were elected to federal office, do you want to pursue that you haven't been able to take a look at or try to use to address at the state level?
Yeah, at the state level, I haven't been able to see some of my priorities move over the finish line, and so the possibilities at the federal level are so much bigger. We have a lot more power working together with those federal dollars, and so making sure that every one of our neighbors has healthcare coverage, so that every U.S. citizen can get the health care they need. I think that should be a top priority, because we have a lot of neighbors who they're struggling to get care. They can't afford to see a doctor. They don't have coverage. And then even the folks who do have coverage, it's too expensive for them to truly take advantage of that coverage and get the care that they need. So we can work together to provide some kind of public option to make sure everyone's covered while expanding the opportunities within the existing programs too.
What does a public option look like that's had different forms over the years?
Yeah, I'm open to the possibilities, and I think there's a lot of different models out there, but I want to make sure that if somebody has their private insurance, they can keep it. But we have some programs that are working pretty well. A lot of folks are pretty happy with Medicare, and they like their coverage, but there's some places where we could improve that with dental and vision coverage to make sure that Medicare can negotiate for drug costs, things like that. So there's just a lot of ways that we can keep expanding coverage to make sure that there's less and less people in the gaps. But we need something for folks. Having health insurance tied to your employment, that was a World War II innovation that was really about just trying to recruit people to jobs, and that's not really where it should be. People should have access no matter what their employment status is. And what I hear from small business owners all the time is one thing that really holds them back and makes it really hard for them to employ staff is health insurance. That they can't afford the options that are out there, that they can't find coverage for themselves and can't find affordable coverage for themselves to be entrepreneurs and innovate. There's a real opportunity to benefit our economy by making sure everyone can have that really important piece.
Do you go little by little at the age, or how do you expand that? Currently with what we have with Medicare, do you go down to 55, 50, 40? Like where do you
Yeah. I think there's room to expand down, because I've met a lot of folks who they have retired but they're not eligible for Medicare, and the ACA plans were the thing that they were turning to, and now we have Iowans who don't have any coverage and they're going without and hoping they can get by and pay out of pocket for what they need, or they're struggling to hold on to the ACA coverage that they have. I mean, that really makes the decision for people about when they're going to retire is, well, when can I have health care coverage? That shouldn't necessarily be driving those decisions. So how do we give people that reassurance and that independence to be able to make decisions based on their employment, and instead of, will I be able to pay for my medications and see a doctor?
You've obviously been critical of the Medicaid cuts in the Big Beautiful Bill, but I think based on today's conversation, Republicans would point to the Rural Health Transformation Funds as a way that they're, building out healthcare in rural Iowa and expanding the way that the state treats and tries to prevent cancer. So what would you say to that sort of defense that we've seen from Republicans of the big beautiful bill?
There's a big difference between $1 billion a year invested in healthcare across all kinds of providers and a competitive grant program that only provides about $250 million a year to hospitals. I've talked to hospital board members who say they're struggling to think of projects and ways that they can apply to spend that money that will help them the most. It doesn't just pay for healthcare, it has to be very specific, targeted projects, and that's not helping people get healthcare. That is one time, and it's only for 5 years. It's not adding up. It's crumbs compared to the investments that were coming into our state and covering our neighbors.
Some of these policies are a lot of long-term, medium-term work. Is there any policies that are short-term that you can tell voters that you'll start pursuing day one, maybe?
Yeah, rescinding and restoring Medicaid funding, so making sure that we get rid of those cuts and restore the funding. I think that would make a huge improvement. We're seeing the negative impacts already, and the cuts haven't even come to effect yet. So there will be damage, but we can start, working through that existing system to get people healthcare coverage and make sure that providers are paid. And then we need to shore up the ACA. There's a lot of insurance providers who are pulling out of those markets because the lack of subsidies have meant that now their products are too expensive for folks and people are dropping out. And that's changing a lot of things for them and not making it a system that really works for them anymore. And so those are a couple things we could do very quickly that would bring a little bit more stability to the system and then start working on expanding coverage and options.
Besides the ACA or extending subsidies and reversing Medicaid cuts, what other types of legislation could we expect you to sponsor or back if you're elected?
Well, we talked about clinical trials, we talked about research. The DOGE effort just came in and indiscriminately started cutting programs and eliminating research projects and setting us back decades in terms of those studies. We need to have policy that will protect research projects and not allow them to be, axed in the middle. We need to make sure that we have consistent investment in research and that we're increasing that research investment. And so that's a direction to go as well. That will make a difference for our neighbors.
The HHS department has cut back on mRNA research, and that's an area that's fairly promising for cancer treatment. Do you have any specific comments on what Congress could do or should do about that?
Science should be guiding research, and that's not what's happening right now. And so attacking a specific technology and medical area because of myths and fear is not serving our communities well. And so we need to support research into those new technologies and understand how they could help people survive cancer and have healthier lives.
All right. Thank you, everyone.
Thank you.